we're going to move on to the next bit. Emotional health. Dr. Stephanie Yin. I'll let you introduce yourself. And she's going to keep the time. She's very energetic. No, she's going to keep the time. This is really important, actually, for us as organisations. This is an area which we think is underdeveloped and something that we get fed back on a constant basis from people, how important but overlooked their emotional health is and the emotional health impact of these very, very traumatic conditions. So this is really, really important. So have a listen, get involved, share your ideas. But Stephanie, really tricky.
Yeah. If I stand here, you'll be visible on screen. Thank you. Hi, everyone. So yes, I am Stephanie. I am a psychotherapist and psychologist and a senior clinical team member of Rare Minds. And I will share a bit about our organisation as we get into thinking about the emotional impact of living with a condition like GBS, CIDP, and the presentation is specifically for those impacted, considering that living with the condition is not just the patient, the person that has the condition themselves, but also loved ones, those involved in caring or part of the family. So just to share a bit about our organisation. So our founder has been working as a psychotherapist with those living with rare conditions since 2013. And we've seen over many years increasing evidence and assessment of need for psychological and emotional wellbeing support, but really a lack of provision. And this is something that is not just in the UK, but globally, as psychosocial needs in rare conditions often quite unmet, and that's reported by not just patients and loved ones, but healthcare professionals as well. And then as an organisation, we designed the first specialist post-qualification training in rare disease counselling, and we launched officially in October 2020. And as an organisation, we're founded in both professional and lived experience. So many of us in the team have lived with our own rare conditions or care for someone who does. And we're a clinical team of psychotherapists, psychologists, and counsellors. We deliver our services mainly online so that we can reach people, so that we're not kind of restricted geographically to where we can deliver our services. And to our knowledge, but always happy to hear if someone has heard otherwise, but to our knowledge, we are the first specialist mental health charity for the rare disease community. So I'll go through this fairly quickly, but it's just to explain a little bit about sort of how we work and the areas that we've developed in the last 4 years since launching. And we have been focusing quite a bit on service provision. So that is delivering sessions, individual and couples counselling, creating group programs, delivering workshops and creating self-help resources. And we always do this in partnership with patient organisations. So as an organisation, as a charity, Rare Minds, we do not deliver services directly. We always partner with patient organisations so that our services are always bespoke and tailored to the needs of the individual community. We also deliver training and support for healthcare professionals in order to kind of increase awareness and considering the sort of psychological impact of rare diseases in healthcare delivery, and also provide supervision and training for volunteers, rare organisation leaders, and frontline workers, again, always in partnership. And also research and awareness, so presenting at conferences, contributing to case studies, trying to build data to evidence also the work that we are doing. All this to try and inform policy and practice and trying to have mental health more embedded in healthcare delivery. So the way that we work really stems from our belief that there is no health without mental health, because there is a lot of evidence to support that mental health and physical health are so closely linked. You know, as a whole person, you cannot separate how you feel physically to how you feel emotionally, because these impact each other. So there is lots of evidence to demonstrate that poor mental health might affect your ability to look after yourself, might affect your resilience, and also poor physical health can lead to higher rates of depression and anxiety. So this is well evidenced as a sort of general kind of phenomena. But when we think more specifically about rare conditions, then there's lots of different points for us to think about. So I know there's a lot on this slide. I will kind of go through each point, but actually I don't think that you will be surprised by the points that I'm highlighting here. This is probably very much your own lived experience, but I think sometimes seeing these things kind of named and written down can serve as a helpful reminder. So we know that one of the key things that affects mental health when living or impacting by a rare condition is the journey to diagnosis. And you may have sometimes heard that referred to as the diagnostic odyssey, because some people can sometimes spend months and years trying to get a diagnosis. Sometimes not only is that a lengthy experience, but it can also be a traumatic one, where you might have had multiple visits to A&E, interacted with multiple healthcare professionals that may have said to you, no, you're absolutely fine, maybe even implied that this is all in your head. And that can be really damaging for psychological well-being, because it can also affect our ability to trust the healthcare professionals when we've experienced being dismissed and disbelieved. So that's quite a vital aspect that affects mental well-being. As you probably know, without me having to remind you, that also, and I think this is one of the themes of our sessions so far today, is that there is often low disease awareness for rare conditions. And that's not just among the public, so when you're trying to describe your condition to friends and family, but also among healthcare professionals themselves. So trying to interact with your GP or other healthcare professionals involved in your care who may have never heard of GBS, CIDP, and in your space, you may find yourself being the expert in the room, which kind of shifts the dynamics quite significantly when you're turning to a healthcare professional and expecting them to sort of have the answers. So we know that can often lead to experiences of feeling frustrated, but can also be quite isolating when you're trying to sort of connect with peers who have never heard of your condition. Linked to that, I would also highlight that living with a rare condition can highlight feelings of difference, which can lead to a sense of isolation. And I think that's why we often see when we have events like today, where patients can come together. It's often well attended, because this might be the only space and opportunity that you have to connect with other patients such as yourself. The living with a rare condition also means having to manage complex physical and emotional symptoms interacting. So that is increasingly prevalent in conditions that might affect things like hormones, which have a very direct link with the mood, but also just in general, as we know, having serious physical symptoms can affect our mental well-being. So there's a very direct kind of link with the symptoms interacting. So I'm just going to have a quick drink. So when we think also about living with rare conditions, we have to consider that there are also lots of uncertainties that we have to contend with. And we like to describe that as macro and micro uncertainties. And macro uncertainties are those bigger uncertainties, for example, thoughts and concerns about how your condition will progress. And then micro uncertainties are things like worrying whether the clinic tomorrow will be running on time, whether you need to organise some help with sort of school pickup or grocery deliveries, lots of these kind of day-to-day uncertainties. But all of these different layers of uncertainty contribute to feelings of anxiety, because anxiety is our brain's way of trying to make sense or trying to make predictable what we don't know. As you probably know, without me having to repeat, as I said, I think sometimes it's helpful to kind of see it written down as well, is that having a rare condition can carry with it quite a high logistical and financial burden. So that would be the financial burden of having to attend lots of appointments in different locations, having to travel quite far. But it might also look like having to purchase specialist equipment for your home or your workplace. And as we know, although there are social services and things in place, those don't always cover all of the logistical and financial burdens that you might encounter. I think one of the sort of also direct impacts of living with a rare condition is actually the emotional experience of going through treatment, and even having to monitor symptoms, and those actually are sometimes reported as quite traumatic. And I think that's certainly something that I know from conversations of speaking with patients, that experiences of staying in hospital and so on can be very directly quite traumatic, and often are rarely addressed or spoken about. We know that living with a rare condition or caring for someone who does can also place quite a great strain on the family and couple relationships, because it might affect the dynamic or sort of how, as a family, you might communicate. You may have different ways of wanting to talk about your condition. Perhaps you might feel that you would like to be very open about it. Your spouse may prefer to be quite private. And so that those kind of different ways of processing and wanting to share information will sometimes place strain on the couple and the family. There is also the visible and invisible aspect of rare conditions, which mean that sometimes having a visible condition means that you can't sort of, you can't hide. People may very openly ask you, what's wrong? Why are you walking funny? And then being pushed in a situation where you might have to disclose. So having to negotiate that visible side, but also what it's like if your condition is invisible and your workplace, for example, are not supportive because they can't see and therefore aren't sure what sort of support you might need or whether you do actually need additional support. So the visible and invisible aspect of living with a rare condition can also be quite tricky to manage. And then we also know that the impact of genetic conditions and inherited conditions can affect our sense of identity and also our decision-making in choosing, for example, to have a family. And that might bring up feelings of grief and loss. So again, as I said, I'm sure that I've probably not said anything that you don't already know yourself. But I think sometimes when we recognize that all of this actually comes together, it can be quite a stark realization how much living with a rare condition can affect our emotional well-being. Okay. So this is just a collection of words at the moment that represents the kind of feelings that you might recognize living with a rare condition or supporting someone who does. And as you can see, if you have a quick look through the slide, that some of these words might be kind of deemed more negative or negative emotions, negative feelings, or others perhaps more positive, for example, resilient or hope. But as you can see, there is a real sort of multitude of feelings that come up with living with a rare condition. And I just want to give you a moment to look through and just really think about, are there sort of certain words that stand out for you, certain feelings that really resonate with your experience? Is there maybe a word or two that actually you would want to add that you feel isn't represented up there, that would capture some of the feelings that you've had over time living on your condition? Okay. So having multiple and sometimes even contrasting or paradoxical feelings is part of human experience, right? We always have both positive and negatives. Through day-to-day, life has lots of ups and downs. So putting these feelings up is not necessarily saying that there's anything we need to do about this, but it can just be helpful to name and acknowledge some of our experience and how this might resonate. Oh, excuse me. Oh, pardon. Indeed. So what can help when we might be experiencing feelings that might feel a bit more difficult? So feelings that might kind of feel harder to sit with. So for example, anger, resentment, frustration. Well, as I said, there's not necessarily anything that needs to be done about these feelings because these feelings are natural. They are part of the human experience. They are part of the challenge of living with a rare condition. But there are ways that we can learn to accept these feelings so that we don't continue to struggle with them. And if you can see the sort of image on the right-hand side is showing the difference between when we try and fight these feelings, when we try and struggle with them, which is that they might amplify and they might feel out of control, versus when we find a way to sort of name, acknowledge, and allow the feeling to pass. So the way that we do that, as I say, is to start with noticing how we feel and trying to name it. Sort of noticing, okay, I'm noticing that I'm feeling quite anxious right now, or I'm feeling angry. Okay, being able to name that already puts a slight distance between ourselves and the feeling in that we are able to observe it rather than being wrapped up in it. And then, and this is a very important step, particularly when we're feeling feelings that might be deemed sort of more difficult, like resentment or unfairness, is do not judge the feeling and do not judge yourself for having it. And I think this is really important. So that's the next step, not judging the feeling, not judging oneself. And then it might be helpful to think about what might help me in this moment. Do I need to talk to someone, perhaps a trusted friend or a partner, a family member? Or actually, do I want to do some movement, whether that's a walk or just some gentle movements at home? Or perhaps might I want to engage in something a bit more creative, thinking about sort of gentle distractions that sort of work for you. And then learn to allow that feeling to pass and reduce. And I think this is another key thing, which is to remember that actually all feelings ebb and flow, even good ones. So by allowing yourself to sit with that feeling also allows it to pass. And then you might reflect back and notice what is it that actually helped or who helped in what moment when I felt those certain feelings. So recognizing, are there specific people in your lives that can be really helpful and supportive when you need to talk to someone. So I know that I pointed out with some of the key themes as to why living with a rare condition is particularly challenging on mental health. But I just want to offer this metaphor, I'm always confused with metaphor and analogy, an image, so to speak, of what might be helpful in terms of picturing why managing a rare condition can feel so stressful at times, why at times we might actually be feeling quite overwhelmed. And that is the stress bucket. And I don't know if some of you are familiar with this, you might have come across it. But it's basically represents a sort of internal container that we all have that represents our capacity to manage stress and things that worry us. So we all have a stress bucket and it has a fixed size. Unfortunately, it cannot get any bigger or smaller. It is just a container. But in the bucket, everything gets moved in more. The stress from ongoing demands of day-to-day life, whether that's trying to get to work on time, whether that's sorting the kids out, whatever that looks like for you, but also bigger life events, bigger things like a COVID pandemic, other sort of bigger issues that add to our stress. So all of these things are contributing and taking up space in your stress bucket. And now you need to think about adding in everything that comes with managing GBS or CIDP. And remember, the bucket is the same. So you're adding all of the stress that comes with managing the impact of the rare condition. So the different layers of uncertainty that I mentioned, the kind of bigger worries around how the condition will progress, what it will look like in a week, a month, a year, the kind of smaller day-to-day uncertainties, managing symptoms and side effects, coping with those difficult thoughts and feelings that we named, and also negotiating relationships, whether that's with friends and family or healthcare professionals, and even fears about the future. So this is also going in that same bucket. And what that means, because it's the same container, and it's a dynamic relationship, so your rare condition stress and your life stress combine in the same bucket, and they each take up different amounts of room. But what it means is that when something is going on with your rare condition, for example, when your symptoms are feeling very difficult to manage, or when you have lots of medical appointments, or you're waiting to hear back from results because your stress level is getting higher, your rare condition stress is taking up much more room in that bucket, which means that all of the life stresses that are trying to get in, there's a place for them to go. And when that happens, your bucket overflows. And how that might be experienced, because this is, as I said, an image, but how that might be experienced for yourself is that feeling of overwhelm, of I can't deal with one more thing going wrong. I can't take another appointment being changed. I don't want someone to ask something of me. It just feels like too much. And that's your stress bucket overflowing. And that's when you might recognize some of these stress signs. So when your stress levels are getting higher and higher because of rare condition stress, life stress, it affects how you behave, how you think and feel, and also your body shows you. So these are just some examples of how stress might show up. And remember that we're all individuals. We all deal with stress in different ways. So for some of us, it might look like becoming quite irritable. Others might actually shut down and withdraw from engaging with friends and family. Some might become very tearful, or you might notice that it affects your sleep. But actually learning to recognize your own stress signs can be really helpful in terms of managing your emotional well-being. Because once you've identified your stress looks for you, how you start to behave when you're feeling overwhelmed and stressed, how you start to think, or how your body starts to show you, then ideally you can start to think about putting in some tools and resources that might help you along the way before you reach to that level of feeling so overwhelmed. So here are just some key things, and I appreciate and I'm so grateful, Rich, that you provided me a big time slot, but actually in some ways I feel that emotional health is so difficult to cover in half an hour because there is so much to it. But I'm trying to sort of give some sort of Cliff's Notes version. And of course, I'm very happy, I'm around all day, very happy to have chats with people. I'm also happy to answer questions later. But just thinking about how can we look after ourselves emotionally? And I think the key thing is to remember that emotional health and looking after our emotional health also takes physical energy. So this is how, as I said before, how it can show up in feeling either more fatigued, really struggling to cope with the physical aspect, is because emotional work takes physical energy. So recognizing that hopefully means that you can be a bit more compassionate towards yourself if you're finding this hard. It's understandable. Try to accept your feelings, not fight them. So going back to the slide about not struggling with those difficult feelings, allowing them to pass, finding ways to manage. Learning to recognize your own stress signs, as I've just said, thinking about how does stress show up for you and what might feel helpful. Learning some relaxation and mindfulness techniques. Now, every time I say that, there's always one or two people in the room that go, oh, because I think those have become kind of key words. Do some meditation, do some mindfulness, and that doesn't resonate for everyone. But remember that relaxation can be a 30-second deep breathing exercise. It doesn't have to be a big 30-minute meditation. It can really just be about noticing, okay, I'm getting anxious. I need to take a couple of deep breaths. That's a relaxation exercise. And also mindfulness, again, does not have to be a a meditation. Of course, if that's something that you enjoy, please do it. But if you're someone who feels like that's not really my bag, that's fine. Actually, mindfulness really is just about being in the present. So you can do anything mindfully. Some of my clients talk about actually being in nature and going on very gentle walks feels really helpful. So how can you do that mindfully? How can you be really in the moment, focusing on how clean the leaves look or what the ground feels like under your feet? It's really just about being in the present moment, and that can feel grounding and can help manage feelings of anxiety. And I will also share some resources of ideas of exercises that you can do for relaxation and mindfulness. Allow yourself to seek comfort and support from others. And I know that that can sometimes feel difficult because sometimes our friends and family don't really know how to support us, but it can also be helpful to identify who in your social support network is good for what. So do you have a friend, for example, that has a great sense of humour and that's always up for a laugh? If you know that you have a friend in that network, that's not the person you're going to go to if you want to have a cry, right? Because they're not going to respond sensitively to your situation. But if you want to be distracted and you want to have fun, that's who you might call. So it's really identifying who in your network is able to provide what, so that you ask the right things of the right people. You might have a friend that's great at showing up for you practically, like offering to pick up groceries for you, to go do the food shop for you. So ask that of them and not ask for that kind of emotional support. So knowing who's good for what. On the topic of relationships as well, I think building relationships with your healthcare professionals is also a key aspect of living with a rare condition, particularly one that requires lifetime support. And when we think about building relationships with healthcare professionals, we think of that as something that has to build over time. It's about building trust. It's about opening communication so you can think clearly on both sides about what you need for your well-being. And as I said before, part of our work is also trying to encourage healthcare professionals to think about and be mindful of emotional well-being in addition to just addressing kind of your physical symptoms. And that might just be when you have a hospital appointment, how are you doing? How are you feeling in yourself? And sometimes even just being able to have that brief conversation, that in itself can feel like emotional support. That might be enough. And lastly, using social media and support networks wisely. Now, I think it's incredible that organizations like GAIN and GPS Foundation have coffee chats, and there are like online forums where you can interact with other patients. But also it's important to check in with yourself. What is this? How is this making you feel? Because actually sometimes engaging too much with other patients' stories, hearing about how other people may have some traumatic experiences in hospital can actually increase your own anxiety. So if you're noticing that in yourself, it's okay to also take a step back. So really think about how this is affecting you. And remember that everyone tends to their own mental health and well-being individually. So noticing what works for you. So I think I'm hopeful that I'm okay on time. I should actually check what time we're in. Oh, brilliant. Perfect timing. Okay, great. So key takeaways are that living with the impact of a rare condition is psychologically and emotionally challenging. I probably don't need to tell you that, but sometimes it's good to be reminded that this is acknowledged. We do know that this is an important need in the community, and there are organisations like Red Minds, but even GAIN and GBS Foundation that hold this in mind. But remember this for yourself when you're thinking, why am I finding this so hard? Why do I feel overwhelmed? Because it is challenging. So be kind to yourself. That's the last bit, really. But managing the psychological aspect of living with a rare condition is emotional work. Be kind to yourself. And also think that looking after your mental health is an integral part of looking after yourself. Because as I said, there's such a strong link between physical and mental health. It might be that your physical health in terms of symptom management is at the best that it can be. You are at an optimal level, but actually you might be struggling. Your resilience levels might feel low. So thinking about your mental health is such a key part in thinking about your overall health. So just to share a few resources. So Rare Minds, we've created a wellbeing hub, and that's a fancy little QR code if you want to have a look at it. But you can also Google Rare Minds Wellbeing Hub, and I've got some little cards to hand out as well. But the Wellbeing Hub just contains more information on kind of signposting and thinking about different tools and resources for managing your emotional well-being. Some of those exercises I mentioned, on breathing exercises, relaxation. So hopefully that will be a helpful tool. And it's a growing hub. So at the moment, it's actually, I think it covers quite a lot of topics, but there's always more that we can add, and that's certainly what we're aiming for. We also have a podcast that you can listen to on Spotify, and the host is our CEO and founder, who speaks with guests on different topics about living with a rare condition. So that might be sort of thinking about the impact on the couple and so on. So I'm going to share with you some general mental health organisations. So for example, you can access support from NHS talking therapies if you go to the website Every Mind Matters. You can also go to the Hub of Hope website and put in your postcode, and it will produce a list of all of the local services that might be able to offer some psychological support. There are also charities like Anxiety UK, which have amazing, phenomenal resources for thinking about anxiety specifically. Of course, all of these are general organisations. They don't necessarily name or acknowledge the unique aspects of living with a rare condition, but hopefully some of the resources are still relevant and can still be helpful. If you are feeling highly distressed and what we might think about as a sort of crisis point, please remember that you are not alone. So there are 24-hour helplines, there are services that are available to you if you're highly distressed. So please do not hesitate to contact Samaritans. They are a listening service. Also, you can contact your GP, although I know at the moment when I say that, everyone kind of goes, yeah, good luck. But that is one of your port of calls, NHS 101. But also remember that if you are highly distressed, if you are having some very difficult or disturbing thoughts, and you do not feel that you have support, you can also present Amy. So please remember to keep yourself safe and remember that you're not alone. And then I think this is one of my last few slides, just some more helpful resources. So, for example, the Oxford University had created a lovely leaflet on managing fatigue. And for those of you that have not heard of the spoon theory, please look it up. It's a really great way to think about kind of energy management and to think about well, I'm not going to go into loads of detail because you don't have time, but please look up the spoon theory. It can be really helpful in terms of thinking how we allocate our energy and why sometimes things like just taking a shower feels like it just is impossible. And then a couple of helpful books as well on sort of living well with a long-term health condition. And then perhaps Headspace and Calm and Butterfly you may have already heard of, again, provide some really helpful exercises for relaxation. And that's me. Was that time? Yeah. Yeah.
So we've balanced physical health and emotional health for half an hour each. That's a good result. There was 4 of them. There's only 1 of you. Well done. Yeah, I mean that's incredible. I don't know how everyone feels about that. I was watching. There's loads and loads of nodding. Phones are up, taking pictures. This is really, really effective stuff. And I think that the bucket, the stress bucket, who can't relate to that and it overflowing and what that feels like when that goes over. So I think there's so much. I mean, I could spend another hour talking about this now. I won't. But what I will ask is for a quick show of hands. Do we feel this is an important subject that we should be doing something about? What? Now, wow. I mean, I mean, wow, that's a lot. I think that was everyone.
And on there.
And on the screen as well. Brilliant. I mean, this is so important. And I think the one my big takeaway just from this section is that I'll be going away to talk with the board about how we take this forward, which I think is pretty important. So thank you so much. Has anyone got any questions? Sorry for Stephanie. Anyone got any questions? She's going to join the panel at the end, but anything now?
And also feel free to come find me if you prefer to have them private.
Super.
Paul has raised his hand. I don't know if it's an opportunity
Yes,
to take that question.
Can we bring Paul in, please?
Paul, you're on mute.
Sorry, I was just raising my hand to say thanks very much. Those boxes you had on your screen there, I could tick every single one as the emotions that I went through and still do from time to time. And I just want to thank you. That was a really good speaking and talk. As been all the guests. I'm afraid I'm going to have to leave you fairly soon. But what a great day. Thank you so much for your time, and especially that one. That was brilliant. Thank you.
That's amazing. Thank you, Paul. We really appreciate that. Thank you.